Good evening. My name is Rashari Mitchell, and I'm going to be presenting to you the COVID-19 Outbreak Prevention Plan for Mitchell and Logistics. So we have 3 locations, one in Milwaukee, one in Memphis, and one in Orlando. And we are working with the CDC on recommendations of reopening all of our locations. Milwaukee, the CDC suggests that we do face coverings and proper training on PPE. We stagger breaks. We use health screenings before entry. CDC recommendations for Memphis: we use floor signage, one-way traffic through narrow hallways, increased distance in work areas. In Orlando, they suggest that we do staggered work shifts, give the people an opportunity to either work 3 12-hour days, 4 10-hour days, and this would limit the traffic during heavy work days. We encourage employees not to have any physical contact, no fist bumps, hugs, handshakes, none of that. And we're going to work on the ventilation system to increase the outside air to be able to enter the facilities more. The problems that we have with Milwaukee are we need additional staff, we need adequate PPE, and we need additional workspaces to encourage the 6 feet social distancing. With Memphis, we need signage, floor and hanging signage. We need hand hygiene stations throughout the building, and we also need additional staff. In Florida, in Orlando, we need air ventilation systems, so we need engineering to come in and check that out. We need new scheduling, so we have to get on Zoom and figure out new schedules for the employees, and we'll have to implement terminal cleaning once the facilities close so that they can be effective for the next shift coming in. Our goals and objectives: the goal for Mitchell and Logistics Company is to transition all employees from working remotely from home to working on-site in a safe environment. Our objective for Milwaukee will be, after completing the training of properly done in PPE, employees at Mitchell Logistics will have gained knowledge on how to apply their personal protective equipment correctly. For Memphis, the objective is, by the end of 6 weeks, the employees of Mitchell Logistics will be confident that the social distancing and wearing a mask will help stop the spread of COVID-19. Objective 3, Orlando, Florida. After applying the signage to the floor for markings, the employees will have a change of attitude towards social distancing. The description of the program: in Milwaukee, staff will go through a checkpoint. They could pre-screen, because we will add an app and you can answer your questionnaire through your pre-screening, but everybody will do temperature checks and receive their PPE for the day. Once they have received their PPE and their dated stamp saying that they've gone through health screening, they will go to their workstation that will be socially distanced. Breaks will be staggered to reduce traffic in common areas. There will be hand sanitizing wipes, hand sanitizer readily available, and we will also encourage social distancing. Memphis, the staff will also go through a health screening PPE. They will follow signage to workstations. During lunch breaks, they will adhere to the 6 feet apart social distancing. In Orlando, staff will follow signage to the designated work areas. Use of personal supplies to decrease the transmission of COVID-19. Sanitizing wipes and hand sanitizers are at workstations, and in the end of the evening, take all personal belongings home. Program evaluation: after completing PPE at the facility, the objective will be evaluated by watching the employees don their PPE while being observed by a qualified staff member. This will be used, qualitative measurement will be used to determine that. After 6 weeks in Memphis of continual work, employee will be asked to fill out a survey expressing confidence levels of social distancing and mask wearing. A mixed method of measurement will be used to determine that. After reviewing markings on the floor, employees will be asked to fill out a survey if they felt the floor signage helped with social distancing. This will also be a mixed method of measurements used. Resources that are needed are funds for additional staff, masks, face shields, gloves, tables, chairs, floor signage, and also hanging signage. Thank you.